My name is Jenna, and I'm taking an online Introduction to Ethics course, and this is my week 4 oral presentation. Ethics is moral philosophy that determines a person's behavior. Morality is right and wrong, good versus bad. So far in my Introduction to Ethics course, I've learned what ethics is. Prior to this course, I had no idea what ethics even was. I also learned that you cannot judge people based off of their beliefs just because they're different from mine. I have to treat everyone equally and fairly based on their beliefs. For example, an ethical issue I've encountered was at work one night. A client had come in to euthanize their family pet. Their pet was a 14-month-old retriever mix. The owner had stated that the dog bit their child. Instead of the owner trying to find their young dog a new home or take it to a shelter, they decided to take the easy route and put her down. I believed that this was ethically wrong. Me being a dog lover and believing that every dog does deserve a second chance at life, I could not let this owner euthanize her. I ended up taking this dog home. This dog now has a second chance at life and is one of the most well-behaved dogs I've ever seen. Even though we both had very different beliefs on the situation, we both found a way to agree on a better outcome for her. One of the discussions I've learned in week 2 is applied ethics. Applied ethics is the application of moral norms to specific moral issues or cases. It is the study of results derived from applying a moral principle or theory to specific circumstances. For example, is it right or wrong for a doctor to perform an abortion? This is a rhetorical question. This is where applied ethics comes into play. There are 2 theories. One being an individual believing that a fetus is a living organism the moment it is conceived. And then you have individuals who believe it is just a cell until you can hear their heartbeat at 8 weeks pregnant. Questions like these drive the search for answers in applied ethics. My future career is occupational therapy assistant, and understanding in ethics will help me in my career by allowing me to not judge a patient based on their beliefs. For example, a patient could come in and discuss a topic about abortion, politics, religion, and even equal rights, all of which are very personal, argumentative topics. Topics like these can start ethical debates because I may not agree with what the patient believes. I would have to remain professional and acknowledge their ethical beliefs. Secondly, I would have to keep all of our discussions confident. This means that I cannot talk to anyone about what we discuss. This would also fall under the HIPAA laws. I would only be able to discuss the patient with a physician or any other doctor under their care. The only time it would be acceptable to discuss the patient with anyone is if the patient informed me that they have or are thinking about self-harm. And that is when I would have to decide between an ethical right or an ethical wrong. It would be in the best interest of the patient to receive the help that they may need. Thanks for listening to my presentation.